So let's continue our topic on anti-rheumatoid drugs. We are discussing colchicine. Today we will be talking about the pharmacokinetics of colchicine. So colchicine, as we know, is used in terminating the acute attack of gout. So when colchicine is given, it is very rapidly absorbed orally. As we can see here, the colchicine is absorbed orally. It goes into the gastrointestinal tract, from where it is absorbed and goes to the liver. In the liver, the colchicine is metabolized by the enzyme known as cytochrome P3A4, and it is then excreted into the bile. And when it comes into the intestine, the part of the colchicine goes in the feces, excreted in the feces, and the part of colchicine is reabsorbed back into the circulation. Here we can see the colchicine is again reabsorbed back into the circulation. Here again the colchicine goes into the liver, and the part of the colchicine goes to the kidney. The part which comes into the liver, it is again excreted back into the bile, and this is known as antirheumatic circulation. So the colchicine goes antirheumatic circulation, and the part of the colchicine which goes to the kidney, it is excreted through urine. So the colchicine has excretion through kidney as well as through bile also. Also, colchicine binds to the intracellular protein called tubulin. Here we can see the colchicine binds to the protein tubulin intracellularly, and that's why it has very large volume of distribution. Because of large volume of distribution of the colchicine, so this drug colchicine undergoes very slow elimination from the body. As we know, it is metabolized by the enzyme cytochrome P3A4. So any drug which inhibits this enzyme is likely to precipitate the toxicity of colchicine. Now about the toxicity of colchicine, the toxicity of colchicine is very high and it is dose related. These include, it can cause nausea, vomiting in the abdomen, it can cause abdominal cramps, watery and bloody diarrhea, and all these adverse effects are dose limiting. Once you reduce the dose of colchicine, these effects come down. Whenever you overdose the patient with colchicine, it is likely to damage your kidney. It can cause kidney damage, central nervous system depression, even respiratory failure and muscular paralysis, and this can even lead to death of the patient when there is overdose of colchicine. Chronic therapy with colchicine can lead to aplastic anemia, agranulocytosis, myopathy and hair loss. So the chronic therapy with colchicine is not recommended. About the uses of colchicine, it is used for terminating the acute attack of gout and for prophylaxis, where we will prevent the acute attack of gout. For prevention of acute attack of gout, we will give colchicine at a dose of 0.5 mg to 1 mg per day. It will prevent the acute attack of gout. For terminating the acute attack of gout, we will give colchicine at a dose of 0.5 mg at an interval of 1 to 3 hourly. The maximum 3 doses we can give per day, and the maximum 6 mg dose we will give in 3 to 4 days, and it will control the acute attack within 4 to 12 hours, which is very rapid when compared with non-steroidal anti-inflammatory drug, which almost takes 12 to 24 hours to control the acute attack. For repeating the next course of colchicine, we have to wait for 3 to 7 days. After 3 to 7 days, we will repeat the next course of colchicine. We can also give the maintenance dose. We have to give the maintenance dose at a dose of 0.5 mg to 1 mg per day. We have to give maintenance dose for 4 to 8 weeks. Until then, the drugs which actually lower the uric acid levels, their action came into account. Only then we can stop the colchicine. So the brand name of colchicine is Goutenil. It comes in the form of 0.5 mg tablet. About the corticosteroids are also used in terminating the acute attack of gout. We will give soluble steroids intra-articularly to the patient at the joint space, where it will terminate the acute attack of gout. Crystalline steroids are not recommended for this action, and these intra-articular corticosteroids we will use only in refractory cases of gout, or those who are not able to tolerate your drugs like non-steroidal anti-inflammatory drug and colchicines. Only then we will give intra-articular injection to the patient. About the systemic steroid, these are also very highly effective drugs in terminating the acute attack. They are also very rapidly acting, and it is as rapid as colchicine. Their action is as rapid as colchicine, and these are the reserved drugs, and it is used only in those patients who are having renal failure or peptic ulcer disease, or those who are not able to tolerate non-steroidal anti-inflammatory drugs, or in those the NSAIDs are contraindicated. And systemic steroids like prednisolone is given 40 to 60 mg for a single day, followed by tapering over few weeks. So this is about systemic steroids in acute gout.